Hi, I'm Dr. Patricia Quinlisk. I'm the Medical Director and State Epidemiologist at the Iowa Department of Public Health. And today I wanted to talk to you about how healthcare providers can help us detect foodborne illnesses. First of all, I just want to remind you that there are quite a few reportable foodborne diseases. You can see a list here. Things like Shiga toxin-producing E. coli, Listeria, norovirus, which is only reportable if it's causing outbreaks, and things like Giardia. Even rare things like anthrax and cholera obviously need to be reported to us immediately. And though outbreaks are usually caused by biologic microorganisms, sometimes it's caused by chemicals too. Those need to be reported also. So there is a lot of importance to reporting foodborne diseases. You healthcare providers are our eyes and our ears out there in the community. We rely on you to help us identify outbreaks early, and that will allow us to prevent further illness. We also can accurately assess the burden of foodborne diseases that are occurring in various communities around the state. So how do you recognize foodborne illness? Well, obviously, patients present with things like gastrointestinal symptoms, but they can be nonspecific, and in cases like botulism, they may be neurologic. We want you to have a high index of suspicion of foodborne illness. Important clues can include incubation period, the duration of their illness, the predominant clinical symptom, and what populations are getting ill. So here are the incubation periods and symptoms from the 5 most common pathogens that we see here in Iowa causing foodborne illness. Norovirus is probably the number 1. Usually people get sick 1 to 2 days later, and while they often do not have things like fever, they will have vomiting and diarrhea. Another one that's very common is Salmonella. Now people can get sick within 6 or 8 hours, but usually it's a couple days and can be as long as 10 days. And things like hemorrhagic E. coli often can take several days also. Thing to remember here is it's almost never the last meal that your patient ate. So some of the questions that will help you to recognize that your patient is suffering from a foodborne illness is to ask the patient if they've consumed in the last 7 days, or the 7 days before they became ill, things like raw or poorly cooked foods, especially meats and hamburger. Unpasteurized milk or juice, home canned foods, that's an indication of botulism, and fresh produce. You can also ask the patient if in the 7 days before they became ill, if any of their friends or families had similar symptoms, if they lived on or visited a farm, if they have pets or animal contacts, because we know a lot of times we get sick from the animals around us, and if they or their children attend child care, or if they've traveled to a foreign country. You also want to ask if your patient is a food service or child care provider. And this is important because they should not go back to food service or to caring for children until they're well again. So for foodborne illness, what do you need to do? Well, if you suspect an outbreak or a bunch of people are getting sick for unknown reasons, we want you to use the enteric kit from the state hygienic laboratory. So find one of these kits, and if you don't have them available, you can contact your local health department, and it will have a test request form inside of it. You can also contact the Iowa Department of Public Health or your local health department for advice about an epidemiologic investigation. Now, the test request form, just going to remind you, like every laboratory form, it needs to be filled out correctly and thoroughly. Make sure the top portion has all the information about the patient. Make sure you ask for the right tests. And at the bottom of the form, make sure you fill out your information so we know who to get back to if we find something in that test. So the importance of a stool specimen is that it will help us to identify what enteric pathogens are making the patients ill. And any bacterial pathogens that you find, we should make sure that the state hygienic laboratory gets them because we do DNA fingerprinting on those bacteria. We share those DNA fingerprints with the CDC's PulseNet database. Now, why is that important? Because these fingerprints are compared around the state of Iowa and nationally to identify if clusters of people are getting ill. This is important especially when we have food at the national level and nationally distributed is contaminated. So have the patient collect a sample during the visit or if they can't provide a specimen during the visit, give them a kit to take home with them so they can collect the sample at home and send it in. Now, even if your patient no longer have symptoms, it's sometimes still possible to get a good sample that will have the organism in it. Now, PulseNet, I want to talk about this for just a minute, as it's very important to us to make sure we keep our national food supply safe. Some of the things we've found from comparing DNA fingerprints from around the country, and you may have heard of some of these, is we found Salmonella Tennessee in peanut butter that had been distributed around the country, especially to institutions like long-term care facilities. We also found Salmonella St. Paul in alfalfa sprouts, and we've had some alfalfa sprouts outbreaks here in Iowa. Also, Salmonella Montevideo was found in deli meats, a pepper chicken if I remember correctly, and we have found Salmonella enteritidis in shell eggs. You probably remember that we had a large outbreak not that long ago here in Iowa with eggs that came out of an Iowa producer. So in summary, it is important to encourage your patients to practice good hygiene. If they're ill, to stay home while they have diarrhea, especially if they work in the food service industry or they're a child care worker. And while they have diarrhea, tell them not to go swimming. We unfortunately have outbreaks from swimming pools. And then call the state health department if you or they have any questions. We'd be glad to help. So here's our number, 800-362-2736 at the Iowa Department of Public Health. If you have questions about specimens, testings, or how to collect them, call 800-421-4692. Or if you think that there might be an institution such as a grocery store, a restaurant, or a market that's causing people to get ill, you can contact the Department of Inspections and Appeals, who's responsible for things like restaurant inspections, at 515-281-6538. Thank you.